What are the best books for surgery? What books should you be reading if you're a medical student who is definitely set on a path in surgery? And what books should you be reading if you're a surgical resident, a surgical fellow, or an attending? I'm going to give you my 9 favorite books, and that's what we're going to talk about today. Welcome back. My name is Dr. Erik Pearson. I'm a pediatric surgeon, and I'm here to scale surgical education and help you reach higher. Today is going to be a little bit different. Instead of talking about the deep, the heavy academics that we've been going on with the metabolic response to injury, you can check that video out, or the surgical nutrition series. I did 3 videos on how to think about and how to order TPN and think about nutrition in your post-operative patient and how to nutritionally assess them preoperatively. And then I also got into fluid and electrolytes, and that was a big one, but I got some good feedback, so I hope you are enjoying that. Today, a little bit different, but I'm going to answer one of the requests, and that was, what are the best books for surgery? What do I recommend? Since I was a medical student and in the hallowed anatomy room at the Royal College of Surgeons in Ireland, we had this awesome opportunity to dissect cadavers, really get to know the anatomy of the human body over about a year and a half. The first year was devoted to the neck down, and the second year was devoted for the neck up. And since that time, I knew that I wanted to be a surgeon. And so I started collecting my surgery books in that first year of medical school. And it's pretty funny, but my buddy Gary Bass, who's a surgeon in Ireland, after every exam, it was like our defense mechanism. We had to go to the bookstore and buy another surgery book. So I loaded up on probably 100 surgery, maybe not that many, but a lot of surgery books. We had a lot of exams. So every exam I went and got another book. There are some good ones. There are some ones that didn't really resonate with me. And so I'm gonna give you my take over the years of being a medical student, a surgery resident, surgery fellow, now as an attending. I'm gonna give you my 9 favorite books. Just like we do in all the academic videos, we're gonna answer why. In this case, why is it important to do a video and do a discussion on the best surgery books? Well, I'm just trying to give you my experience with doing some books that were helpful and some non-helpful, some that were approachable and some that aren't approachable at all, and kind of distill it down to the books that I found the most helpful over this time. So why is that important? Well, it's important so you can stop wasting time, wasting money, and get to the books that I'm hopeful will resonate with you and be helpful for you. Now these books won't be for everybody, but I think they're a great starting place for anyone interested seriously in a career in surgery. So the first book, I'm not going to go in order. So these aren't books for medical students all the way up to an attending. I'm going to hit you with my favorite book first. And this is Top Knife by Ken Maddox. And this is probably the greatest piece of surgical gold you'll be able to get out there. If you're a medical student, buy it. If you're a resident, buy it. Fellow, buy it. If you're not a trauma surgeon, it doesn't matter. This book has so many lessons in it that you will be very, very thankful after you've got it and you've started to read it. I read this book every year as a resident. I read this book every year as an attending, as a refresher. There is just so much expertise and wisdom to get you out of tough situations. And so I'm going to give you a couple of little hints here of why I think it's great. First, just take a look at a couple of these chapter titles. You see these chapter titles and then you know, I need this book. The first one, like chapter 3 is your vascular toolkit. Who doesn't want that? I want to know exactly what to do when I get into a tough situation, and some tough situations are when it's bleeding. Next, chapter 6, the injured liver, the ninja master. Anyone who's been in bad trauma and bad bleeding operative hepatic injuries knows that you have to be the ninja master with a liver, and you need to know every which way to go about it to control that bleeding. Chapter 11, the no-nonsense trauma thoracotomy. Maddox makes it super simple, straightforward, how not to hurt yourself, hurt the patient, hurt other people on the team, how to stop bleeding, get resuscitation, get control. Awesome chapter. And then finally, chapter 14, the neck, safari into tiger country. It couldn't be more true. I love the titles. The whole chapters are even better. And then he goes into these great little pieces of wisdom. I like the quote, choose a definitive repair that fails well. Don't get yourself into trouble with complicated repairs, especially if you're doing damage control laparotomies. Second piece of advice I like is the finger is mightier than the clamp. If you're doing a posterior perforated duodenal ulcer that's bleeding like crazy from the GDA, you open up the duodenum, what do? You don't need to get a clamp in there, just put your finger on it. If you're in bad bleeding trauma, what do? Put your finger on it. Take a deep breath. And then finally, I like this one, don't fiddle, be a rock. And trauma surgeons, the really good ones, they don't fiddle, they get in there, get the job done. And then finally, I just want to show you what type of gold is available in this book. Check out these 2 pages. One is when you get some temporary control of the bleeding, you got to stop, reassess your team. What tools do you have? What tools do you need? Don't fiddle, be a rock. This other page here shows you common places in a trauma laparotomy where you're going to have missed injuries. It gives you a little diagram here, give you some things to think about. Top Knife, Maddox, my favorite book for all levels. Go ahead and get that one first. So the second book I want to talk about is the key reference text. Now, there are a lot of key reference texts out there, and I recommend that you find the one that resonates with you. You have Schwartz, you have Greenfield, you have Sabiston, you have Bailey and Love. They're all big, thick books, but they're required reading, at least one of them. I like to recommend to the residents, read at least one major textbook a year. And if you get through it and you read for a half an hour to 45 minutes every day, you'll get through a major textbook no problem. My favorite is Sabiston. I think it's the most frequently updated. I think that when you go to the board exams, the ABSITE, every question that is on the board exams, the ABSITE, the answer will be in Sabiston. It has a great mix of both basic science and clinical evidence. It's definitely dense and it's a reference text, but it can be your go-to for almost everything if you're looking for that educational background in surgery, and it's definitely consistently updated, which I like, because information in surgery changes very often. You know, one of the other things that I like is that it's fairly thoughtfully constructed with the tables and the charts, and they also have some pretty interesting chapters. You know, the new ones in the new 20th edition, you have a chapter on regenerative medicine. You have a chapter on bedside surgical procedures, and you have a chapter on the surgeon in a mass casualty incident. I was in a mass casualty incident in October 1 here in Las Vegas, and as a surgeon, it's really important to have that knowledge of how you can be most helpful and be an important resource in MCI. And then the last thing is that the references are landmark papers. And so when you read a chapter, whether it's on abdominal aortic aneurysms or surgical nutrition, you can go to the reference section in Sabiston's, and basically those are the papers that you should read if you want to read the landmark papers in surgery. The third book is one of my favorites. This is awesome for medical students and very great reference for interns, second years who want a historical perspective and the real down and dirty of the history and physical exam and surgery. And this is Cope's Early Diagnosis of the Acute Abdomen. And this is an awesome book. I've read it probably cover to cover 3 or 4 times. And the first few chapters are fantastic because it goes in those details that you need to elicit and the importance of making a diagnosis before you proceed with labs and imaging. And I think now in the current environment where we have a lot of protocolized approaches, for instance, for the diagnosis of appendicitis, we've gotten away from really detailed history and physical exams. But I was trained in a very traditional environment in medical school in Ireland where the history and physical exam were deemed to be the most important thing that you could learn. And so I'm a big believer in a detailed history of physical exam, detailed pain questions, so you can nail that diagnosis and then get your labs and imaging to help you confirm the diagnosis. If you take a few pages from here, it kind of reads like a novel. It goes through how to do your history, how to do your physical exam, talks about referred pain, and then it goes into each specific diagnosis in the acute abdomen and goes through in detail variations of the history and physical exam and what you can expect. So it goes through a chapter on acute appendicitis, acute cholecystitis, diverticulitis, all those things that are the every night consult for the general surgery intern. So if you're an intern or you're a medical student reading surgery, Cope's Early Diagnosis of the Acute Abdomen, put that top on your list. The next book, everybody needs a really good atlas. And so if you are the medical student that just poured over your netters and you loved all of those slides and all of those anatomical plates, then Zollinger's Atlas of Surgery is definitely one for your shelf. Now this is a little bit bigger. It's like not the same format as the other textbooks, so it kind of lays a little weird on your shelf. But I'm going to show you a couple of plates, and it's just awesome detail. And when you're studying for that operation, whether you're a medical student going in the next day and you need to know, the vascular supply to the stomach, or you're a resident and you want to know what that approach is going to be and what the steps are going to be and doing a bowel anastomosis, or you're an attending doing an operation you haven't done in a while and you're thinking about the anatomy, this book is a great reference. You can take a look at these two slides on the vascular anatomy of the stomach and the drainage of the stomach and just see that the level of detail is superb. And in this other plate, when we look at how to do stricturoplasties, whether it's a Heineke Miculitz or a Jaboulet, you can see that pictorially, if you're a visual learner, this totally gives you the level of detail, how to set up your sutures, how to put your stay sutures in, how to set up the anatomy. It makes it really crystal clear so that if you're a medical student going in and watch an operation, you'll be able to look at Zollinger's, go see the operation, then go back to Zollinger's and be like, okay, that's how they do it. So Zollinger's, definitely get that on your shelf. Going back to another one of the classics is Marino's, the ICU book. Now this is actually everything you need to know in the ICU. When you're a surgery resident and you're going to the ICU, it can be quite an intimidating experience because you're learning a lot of the why behind all of those measurements. You got to know, well, why does the ventilator work and what modes do I need to use? Why do certain vasoactive medications work and how do they work? Why would milrinone be good in one patient but it would be horrible in another? Who do I want to give phenylephrine to and why? You'll learn about the alpha beta meter and all of those little details. So the Marino book answers the why and the unit. You can read it cover to cover or use it like I did, just a reference for those difficult situations. And when you really want to understand vasoactive medications, ventilator management, fluid balance, dialysis, blood products, all of those things, they're in that book. This is what I would say would be an absolute must for anybody that's in surgery, critical care, trauma, to have on their shelf and read it frequently. Now for the senior residents out there, or for the fellows, or the surgeons, the book that I think is the reference text to have on your shelf, I call it not so much the why manual, but the how-to manual, is Cameron's. I think from cover to cover, this is probably the one book that has such a rich supply of how to do a particular operation. Now check this slide out. So the cool thing about this book is this gives you the perspective of a surgeon who is getting ready to do that operation. And so on this slide, they're looking at how do you set up a laparoscopic fundoplication? What are the important points? The important points aren't necessarily the sewing of the fundoplication. That's easy once you have that technical skill. The hard part is deciding what ports you're going to use, where are you going to put your ports, how are you going to stand, where do you want the scrub tech to stand, where do you want your assistant to stand. All of those little things either make the operation easy or make the operation very difficult. When you're with surgeons who make everything seem easy, it's because they set it up to be easy. And this book gives you those how-tos, those pointers, those little clues on how you can be much more prepared and much smoother when it comes to setting that operation and then getting through it. So Cameron's is an awesome book for the senior resident. I wouldn't really start reading this too much until you're in your third, fourth year. Definitely refer to it as an intern, but when you're an intern, I would definitely push you back to the Sabiston so you can understand the why. And then when you get that why down pat, you've read through Sabiston's, you've read through Top Knife, you've gone through Marino's ICU book, you switch over to Cameron's how-to manual, and you will be totally set for not only doing safe operations, but set for your board exams as well. And so what talk on the best books in surgery would be complete without putting in Steve Pfizer's review manual for the ABSITE? The ABSITE is a necessary evil. It's something we take every year. And what's important about the ABSITE, or the American Board of Surgery and Service Training Exam? The important thing is that there is this value, or at least the most recent value in the literature is 30%. If you're scoring above a 30% every year, then you can confidently say, I'm going to pass my written board exams. If you're under 30%, then you're going to be a little higher risk of failing those board exams. The ABSITE is a great review book. By no means should you use this as a reference book or your only source of reading. That is just heinous, all right? But when it comes to reviewing for that exam and doing well, I would say you take this book, you go through it a couple of months before the exam, you review a little bit about it every night, and then when you go hit that board exam or that ABSITE, you'll be able to nail those questions like, oh, what are the stages of wound healing? Or what are the stages of an empyema? Or where does this particular artery go? Those things this is a bullet pointed book. I think it's necessary because, you know, it's good to do well on the ABSITE. I consider it kind of your get out of jail free card when you're a resident. But just put the ABSITE review on your shelf, and then you'll be prepared for the ABSITE as long as you use it more than just the night before the exam. We're gonna get down to the last two books, and I gotta put this one in here. Now this book, Talley and O'Conner Clinical Examination, this isn't just a surgery book. This is the clinical examination book. For all the medical students out there, please buy this book and read it cover to cover. Even if your school doesn't believe in or just teach the clinical examination like it is the most important thing, I'm a believer that it is the most important thing, that if you can do a great clinical exam, you can have really good confidence in your decisions. And the Talley and O'Conner Clinical Examination book is probably the most detailed clinical examination book with awesome pictures. Check this out. So the book will go through all of the inspection, palpation, percussion, auscultation, all of those steps of a physical exam, plus all of the little detailed exams that you do, you know, in the vascular exam, how to do the different lifts, how to feel for pulses in particular places. You know, for an inspection, it will go bullet by bullet. This is the thoracic session, so it goes through bullet by bullet. What do you need to do in your inspection phase? It gives great pictures. So in pectus excavatum, this is what you look for. And it gives you all of the techniques you need to do and how to do those techniques. So I highly recommend this book. All the medical students, please definitely get this. If you're a resident already and you need a good clinical examination book, definitely get Talley and O'Conner. Finally, the textbook that brings everything together. This is an awesome reference text. It would be difficult to read cover to cover, but it's great to go to for particular operations. I refer to it probably every day as a senior surgical resident, as a chief resident for sure. And then now as an attending, I've gone back to it a number of times. And this is Fischer's Mastery of Surgery. And I'm gonna show you what makes this book so unique. Is if you take something like ventral hernia repair, it will go through all of your patient selection. It will go through your approach, whether you're doing open or laparoscopic. It goes through in cases where you have enough tissue coverage and in cases which you don't. It'll go through what type of meshes to use. And then it'll give you description and pictures about how to actually set up and do the operation, which aren't just diagrams, but they're actually operative photos. And this book does it all. It's in 2 volumes. It's a huge set, but it's basically every single operation in general surgery. The other cool thing is it goes through all of the history too. So if you want to know how to do a McVeigh, how to do a Vicini, when to do one over the other, how do you do the plug and patch, how do you do the TEP versus a TAP? I mean, these are all different hernia operations. But this book will give you the history of those operations and then take you through the details so that when you're in a position and you need to fix that femoral hernia with a Cooper's repair, you can either refer to it or you've read it in Mastery and you know how to do it. So there it is. Those are my 9 favorite books in surgery. You got Top Knife by Maddox. That is a definite must read. Anybody who's interested, go get that. If you think you're interested, get the book and read it, and you will be so inspired to be a surgeon. I absolutely love this book. I read it every year. Then you want to dip into a reference text. Sabiston's is the one that resonated most with me. Maybe for you it's Schwartz, or maybe it's Greenfield's. Definitely check it out at your medical library and then just dive in and buy one. It's expensive, but it's definitely worth the investment. I still have all of mine on my shelf and I refer to them regularly. Third is Cope's Early Diagnosis of the Acute Abdomen. All the medical students definitely get that book. It's a totally awesome read. It's a bit historical, and so if you're into the tradition of surgery, you enjoy the history, you're going to really love that book and definitely respect that a lot. Next is the ICU book by Marino. It's heavy, it's dense, but it is totally awesome. And then you have Cameron's, which is your how-to book for surgery. And for the senior residents, for the surgeons out there, this is a totally awesome book to know how to set up your operations, choose your ports, choose your incision, think about what you're going to do, what's plan B, what's plan C going to be. And then you have the ABSITE review for all of those times when you need to do well in your exam and you just need to review those bulleted points. You have Talley and O'Conner, hit that clinical examination. It is so important. I can't emphasize that enough. We'll actually do a talk on the acute abdomen and how to do a good history and physical exam. And so I'll bring in a lot of those points from Talley and O'Conner. Then finally, Mastery of Surgery, the book that brings it all together. Definitely for all the residents out there, just invest, ask for it as a Christmas present or a Hanukkah present or a birthday present, or maybe your program director can get it for you. Just a totally awesome text. And I hope that this was helpful. You can check out the reference page at Citizen Surgeon, and I'll do a quick, my take on each of these books, kind of try to point you in the right direction. We're going to have another talk coming up in another week on the acute abdomen. Then we'll get back into some of the more basic science of surgery, and I'll direct you towards thrombosis. We'll hit that topic and a few other really good ones. So that's it. Thank you so much for watching. Make sure to subscribe, hit the notifications button so you know when these videos are coming out. Engage with the community, ask me questions. I'm totally excited to help scale surgical education, help you reach a little higher. All right, peace out.